Articulation and Feedback Scenario 4. Articulation Practice and Feedback. Students in Mr. Winter's AHLT 230 Medical Laboratory course are learning the proper procedure for venous blood collection. The workplace capability for the course is tolerance. It takes Mr. Winters 20 to 30 minutes to present the step-by-step procedure that would be followed when performing venipuncture. He spends about another 5 minutes answering questions regarding the technical components of performing this workplace task. At this point, Mr. Winters introduces another aspect of blood draw, the patient. He asks the students to think about how the disposition or reaction of the patient or family member can affect the process. He asks them to think about how they feel when they need to have blood drawn. He then breaks the class up into groups of 3 to 4 to work together and articulate within their group possible answers to the following questions. Number 1. What factors in regards to a diverse patient population do you think should be considered as part of the training for this task? Example, language barrier, mental health disorder, age, etc. A. After identifying an important factor, how might you modify the process? Example, you need to draw blood on a developmentally disabled patient. You might decide to have a worker from the patient's group home who is familiar with the disposition of that patient present during the venipuncture. Number 2. Could a patient that is very anxious interfere with your ability to follow the proper procedure? How? A. What might you do to minimize the chance of making a mistake? Number 3. When drawing blood in a pediatric patient, how might a parent help? How might they interfere with the task? A. How could these considerations affect the policy of an institution when deciding if a parent should remain present when drawing blood on a child? B. Would the age of the child matter? Mr. Winters circulates around the classroom to facilitate discussion, and after about 15 minutes, he asks for everyone's attention. He then reminds the class that the workplace capability for this class is tolerance. He then asks each group to articulate to the class how tolerance is related to an appreciation for patient diversity and why this is critical when performing the seemingly very technical task of drawing blood. Please reflect on the following questions. 1. How did the instructor use a discussion strategy to ensure that the workplace capability assigned to the course was incorporated into the content of the course? 2. What techniques or strategies did the instructor use that you could use in your own courses to ensure that students had opportunities to develop their ability to articulate workplace readiness?